Are you a woman over 70? Are you confused about which health screenings or checkups you should continue to have now that you are a senior? In this video, we'll talk about 5 health checkups that women over 70 should avoid. Let's dive in. Hi, I'm an expert in women's health, specifically women over 50. So if you're new here, welcome. And be sure to subscribe so you get my weekly videos. The American healthcare system does not do a good job of teaching us what screening tests we should be having once we hit a certain age. This is because doctors and other providers often want to practice defensive medicine, meaning they order lots of tests, so they don't miss anything. But for older adults, especially over the age of 70, many of these screening tests can do more harm than good. In previous years, I worked in a large academic medical center as a nurse practitioner, and I took care of many patients over the age of 70. When it came time to discuss their annual physical or yearly health screenings, I would always ask them, "What are your goals? What are you hoping to get out of your doctor visit?" Often the answer was, "I don't know. Just tell me what I need to do." Over time, I realized that many seniors just do what they've always done. They roll up their sleeves and get whatever their doctor recommends. This works until they have a negative result, and then they get freaked out when their doctor suggests additional follow-up testing. So in today's video, I'm going to share with you 5 tests that most women over 70 should avoid having done. And be sure to stick around to the end, because I am going to explain why it is so important to avoid unnecessary screening tests. 1. Women over 70 should avoid routine mammograms. Now this is going to be controversial for many people because breast cancer is scary. However, starting at the age of 50, a woman's risk of getting breast cancer doubles every 10 years. So if you're 70, your risk is 4 times higher than it was at 50. The question is, how do you balance the risk of breast cancer with the harms of a mammogram? Now let's talk about the harms of mammograms. Mammograms compress the breast tissue, and most women find this extremely painful. Mammograms can also lead to unnecessary biopsies. If a mammogram shows something suspicious, then the patient is called back for additional imaging, often called a diagnostic mammogram. Then if the suspicious area cannot be explained by either the additional mammogram or an ultrasound, then a biopsy is performed. Biopsies can be emotionally and physically exhausting. They are expensive, and they carry with them a small risk for infection and bleeding. If a breast cancer is found, then additional testing is required. It's called staging. Staging tests include blood work, X-rays, ultrasounds, and MRIs of the affected area. All of this is done to determine the stage of the cancer. Stage 1 means that the cancer is localized to one area. Stage 4 means that the cancer has spread to distant parts of the body. Many women who are over the age of 70 and are diagnosed with breast cancer actually have stage 4 disease, meaning that the cancer has already spread to places like the bones, or the liver, or the lungs. These women really shouldn't undergo surgery, followed by chemotherapy and radiation therapy. There are better options, including palliative care, hospice care, and even clinical trials. But oftentimes, these women are never offered these options because they are instead encouraged to pursue very aggressive treatment plans. One last note about mammograms is that oftentimes the radiologist who reads the mammogram is not the same person who ordered the mammogram. I'm talking about the doctor who actually prescribed the test. Sometimes there is a miscommunication between the doctor and the radiologist regarding whether the results are positive or negative. For example, a doctor may order a mammogram because she thinks there might be something concerning, but the mammogram comes back negative. The radiologist looks at the mammogram and says, "All is okay," but the doctor who ordered the mammogram doesn't receive that information. Instead, the doctor assumes that the mammogram was never done and that the patient still needs to be evaluated further. Can you see how confusing all of this is? This happens more frequently than you might think. And at any age, a misdiagnosis like this could be devastating. 2. Women over 70 should not have their prostate, specifically their PSA levels, checked. Prostate cancer is another cancer that increases in occurrence as men and women age. However, the problem with checking PSA levels is that oftentimes the screening leads to overtreatment. And unfortunately, prostate cancer is very slow growing. So many men die with prostate cancer rather than from prostate cancer. Also, prostate cancer can lead to urinary symptoms such as incomplete bladder emptying, dribbling and increased urinary frequency. So by treating prostate cancer, many men suffer from urinary problems earlier in life than they would have had they not been screened. No. 3. Women over 70 should not routinely have their colon checked via a colonoscopy. Similar to breast cancer and prostate cancer, colorectal cancer rates increase significantly as we age. However, there are some significant downsides to screening for colorectal cancer. The first downside is the preparation to view the inside of your colon. It must be completely empty, and this requires that you drink a gallon of a nasty-tasting solution. The second downside is that a colonoscopy carries with it a risk of perforation, meaning the scope pokes a hole in the colon. This is a rare but serious complication, and I have cared for several elderly patients who suffered from this problem. The third downside to colonoscopies is that the procedure can lead to a false sense of security. After undergoing a colonoscopy, many people feel invincible, and they forget that polyps can grow back. Polyps are small growths in the colon that have the potential to turn into cancer. The average person has no idea how fast a polyp can grow into cancer, and it can happen very quickly. Number 4. Women over 70 should not have an EKG or electrocardiogram done routinely. An EKG is a test that checks the electrical impulses of the heart. In the past, it was thought that if someone had risk factors for heart disease, such as high blood pressure, diabetes or a smoker, then they were at increased risk of heart disease, and perhaps an EKG needed to be done. However, a 2019 study looking at over 180,000 people found that an abnormal EKG did not necessarily mean that someone had heart disease. The researchers concluded that EKGs are too unreliable to be used as a screening tool, and if an EKG does show an abnormality, it is hard to know if this is due to a true cardiac problem or simply an age-related benign variant. Number 5. Women over 70 should not have a bone density test done routinely. Bone density tests can help doctors diagnose osteoporosis, which is a condition where the bones become weak and brittle. Osteoporosis becomes more common with age, and it primarily affects women after menopause. But the problem with bone density tests is that they expose the patient to radiation. Doctors are trained to weigh the risks and benefits of each test they order. And when it comes to bone density testing, the radiation exposure is hard to justify. If a woman is diagnosed with osteoporosis, then what is the next step? Typically, a doctor will prescribe medications that carry with them a host of potential side effects, including an increased risk of fractures, not to mention the cost of these medications. So is the radiation exposure truly worth it? I would say no. I hope you found this information helpful. Please leave me a comment below and let me know if you've ever had any of these tests. Also, please share this video with your friends. Thank you so much for watching. And remember, knowledge is power. Use it wisely. Bye.